parliamentary committee finds that more than 50% of women struggle to purchase period products every month.
It's a startling reality that has pushed Minister of Gender and Child Affairs Ayanna Webster-Roy to commence discussions with both the Prime Minister and the Minister of Finance about reducing the cost of these essential products.
And as you'll hear in this Carissa Lee report, there are other surveys that have had similar findings. It means many of these women have been forced to opt for unhygienic alternatives.
A girl called me one day and she said that she didn't have a choice. She had to use her baby's diaper.
Period poverty refers to the inability to afford and access menstrual products, sanitation and hygiene facilities, and education and awareness to manage menstrual health. A Joint Select Committee survey on human rights, equality and diversity of approximately 2,000 women found that 94% couldn't afford period products. Meanwhile, a 2021 Safe Cycle report showed that more than 50% of women said pads were not affordable. Similarly, a Cromwell TT survey conducted by Dr. Nadira Rambokas on 504 women revealed that over 76% of women thought the same. And over 50% of those surveyed added that they had to improvise or use a cheaper option. According to the doctor's findings, some menstruating women use rags, toilet paper, paper towels, and even cloths and pins. It's an alarming reality, one that Avenel Hector Joseph of the NGO ITNAC says many women face monthly.
There are mothers who call crying because both of them as young mothers, and you have a teenage child, and there are two women in the house menstruating.
Minister responsible for Gender and Child Affairs Ayanna Webster-Roy has started discussions with both the Prime Minister, Dr. Keith Rowley, and Finance Minister Com Imbert about the cost of feminine hygiene products. She has also commenced discussions with the Education Minister to make feminine hygiene products available to schools for use by girls. Meanwhile, President of the Supermarket Association, Rajiv Dipti, says as living expenses increase, women put aside their needs for the household. He calls on the government to treat period products as a form of basic health care.
There needs to be provisions for in recognizing that this is the health that meant that a woman's menstrual cycle is part of her health.
Period Poverty Awareness Week started last Monday and will end on Tuesday. Carissa Lee, CNC3 News.